Rare diseases do not discriminate. They can impact anyone at any time of life. But one thing is certain, a rare disease diagnosis profoundly changes a patient's life and the lives of those around them. We visited Manchester to learn more from specialist rare disease clinicians about the whole patient journey, the impact on families, and the advances in awareness and treatment options.
The teams that support patients with rare diseases make a huge difference to how they and their families manage that cruelly unique journey.
Some of our conditions are super rare, so there's hardly any people alive with them, and some conditions we treat here, there are 4 or 5 people in the whole country with the same condition as you. So that is really rare, and you might feel like it's only me and I'm the only one. My job is to promote integration, engagement, and show that having a rare disease doesn't mean you still don't get to have a life.
Although rare diseases are individually rare, collectively they are common.
It's actually not that rare to have a rare condition, but what they all have in common is getting a diagnosis, getting access to treatment, and dealing with the impact as a family.
Delays in diagnosis can have serious repercussions.
It means you don't get treatment on time. It means that you can develop sort of psychological complications of having your symptoms when no one believes you, and that can be really quite stressful and difficult.
Even with a diagnosis and the support of healthcare professionals, managing it all can wreak havoc on families.
A rare genetic disease, which is unknown, where there's perhaps not good treatments or prognosis about, is devastating. The more destructive the disorder, the worse the psychological adjustment, the more devastating it can be for the family. You know, financially, psychosocially, emotionally, divorce, breakups, mental ill health in brothers and sisters. It's a sledgehammer to families. There are services around, there are support organisations, there are NHS professionals like me who can try to support and help make it that little bit less challenging.
One of the biggest challenges facing rare disease patients is the transition from the gentle world of childhood medicine to adult services.
We spend a lot of time focusing on the transition of our young people to adulthood, and we take several years over that gradual transition from childhood to adulthood, from childhood care under paediatricians like myself to adult care under adult sort of rare disease specialists.
We are now seeing patients that we would have never seen before in adult practice because of the fantastic care that they've had from Simon Jones and colleagues in the paediatric metabolic sector, for example. We try and see the patients initially in a place of great security and safety, i.e. in the paediatric sector, several times. We obviously talk closely to the clinicians and the other specialists so that we know the story of that individual patient and their individual needs, so that we can personalise their care when we move them into adult practice.
Mark has seen the outlook for patients with rare diseases improve over the last 20 years.
Physiotherapy, good nutrition, psychological support are all critical still. But specific treatments have emerged increasingly in recent years. So it's been a really empowering and important field to work in.
When I started this career 20 years ago, lots of children we would meet would die pretty quickly. But now there are new opportunities, new research studies. There's so much research going on. It feels like there's a little bit of hope we can offer people.
I've always been struck by that important mantra of rare but potentially treatable, and that really is what we want to do. We want patient-focused research to guide our treatments for today and more treatments for tomorrow.